Harvey Norman Big Sale is now on, with big savings across our range of Samsung 55-inch smart TVs. Experience cinematic viewing with limitless contrast on the S90C OLED TV. Was $1,499, now $1,399. Or enjoy incredible 4K picture on the ultra-slim Q60C QLED TV. Was $789, now $699. And with our best prices guaranteed. So why shop anywhere else? The Harvey Norman Big Sale is now on. Don't miss out.
Mr. Blue Sky.
Tonight's Lotto jackpot is an estimated €12 million. So, what's the first thing you'd do with €12 million? That is genius. Better get a ticket, so. The National Lottery. It could be you. Play responsibly. Play for fun.
A beautiful bouquet of flowers. It can say more than words ever could. To celebrate, congratulate, or just let someone know you're thinking of them. At flowers.ie, we know every bouquet is special. So every order we receive is hand-picked, arranged with care, and delivered with love across Ireland. We even send a video before it's delivered, so you know it's just right. Say it with flowers at www.flowers.ie. Rated 5 stars on Trustpilot. Discover the wonders of Clontarf Castle, where 12th century history meets 21st century luxury. Explore our perfect location just 10 minutes from the city centre and indulge in our winter retreat offer from just $299 per night, including dinner, bed and breakfast, plus complimentary bubbles and chocolates in your room. Book now at clontarfcastle.ie.
Thinking of selling a property? With Auctioneera, you can save thousands of euro. We offer a full estate agency service for a low fixed fee. Maximise the value of your property. Minimise your estate agency costs. Pay a fixed fee, not a commission, with no sale, no fee. See auctioneera.ie.
Snap is here to get you noticed. Your local experts in print and marketing solutions are here to help your business become the talk of the town. Talk to Snap or visit snap.ie.
Lunchtime Live with Andrea Gilligan.
Brought to you by Active Iron, the iron supplement for women. Voted 2023's best Irish pharmacy brand.
This is Newstalk.
I know thousands of you on some of the best value health insurance plans out there have faced fairly large increases to your premiums over the past week or so. Demot Goode from Total Health Cover, which is part of the Lockton Group, is with us on the line to answer your queries today. Patricia, you've a question for Dermot first of all.
That's right. Thanks, Andrea, and thanks, Dermot. It's a question about my husband's health insurance, actually. He's with VHI Health Access. He is 68 and in reasonable health. He needs good orthopaedic cover and good asthma cover. He's happy with semi-private, happy with an excess, but he's getting nowhere with VHI in terms of having a conversation about getting a better return on what he's paying for his cover, or whether, in fact, there's a better plan available to him. I don't know if that's too much information, but that's the question.
No, Patricia, that is absolutely spot on. So, look, his current plan is going to cost, I think, €2,117. The issue with VHI is there is no other lower plan really with VHI where he will keep the full orthopaedic cover. My suggestion to you, contact Leia Healthcare, ask about a plan called Simply Connect Plus. It's €1,722. So if you like the plan, it's going to save potentially €400, but it's a brilliant corporate plan. He keeps his full orthopaedic cover and he also gets guaranteed refunds on outpatient expenses. So the plan to check out, Simply Connect Plus with Leia Healthcare.
I hope that helps, Patricia. Thanks a million for getting in touch. Helen has a question as well. Helen, what's your query for Dermot?
Hi, Dermot. I'm 58 years old, in reasonable health and due to renew my health insurance in about 2 weeks' time. I'm currently on the Irish Life Health Guide 2 plan, which I know you think highly of, but given my age, heading for 60, should I consider upgrading my cover, do you think?
Yeah, I'll tell you, Helen, very good question. Look, the plan you have is an excellent semi-private corporate plan. I think it's 1,420 is the new premium. What I would suggest there, so for example, what are the risk factors? The main risk factor is you're not fully covered for things like hips, knees and shoulders to get the full replacement, and cataracts. So what I would say to you right now, if none of those things are really of concern to you right now, in other words, that there's no pending surgeries, I would be suggesting potentially stay where you are if the rest of the plan is working for you. But it would be something that you should consider each year. Because look, the worst case scenario, if you need to upgrade your cover If you have no existing conditions, you get the higher cover straight away. If you have an existing condition, it'll take 2 years before the extra cover kicks in. But like Helen, right now, that's still a good plan. And to go on to the higher plans with full orthopedic cover, you could be spending an extra 500 to €1,000. So I'd probably stay where you are right now, but check it each year.
I hope that gives some comfort, Helen. Thank you for getting in touch. 1800 453 106. Mary, who are you inquiring about today?
I'm inquiring about my mother, who has a plan. She's 100 plus years, and she's paying roughly €180 a month, which she can ill afford at this stage. Now, she does have a medical card, and I'm just wondering, last year she had a visit to a hospital, and it was all covered by her medical card. I'm wondering, is it necessary for her to continue taking out this policy every year?
Okay, Mary, very good question. No straightforward answer to this one, I'm afraid. So what we normally advise people is that, look, as people get much older and as the likelihood of them being admitted to private hospitals decreases, then they're better off tapering their cover back. So, they maybe hold minimal cover for private hospitals and obviously being fully covered for public hospitals. Now, because your mother has the medical card, there will be no charge in the public hospitals. I don't know the name of your plan, so I can't be, I suppose, very specific. I would suggest you still keep some type of mid-level cover in place, something like the Enhanced Care 350 with VHI or the Signify with Leia or the Benefit Access 300 with Irish Life. The only reason why I'm saying that, Mary, is, for example, if somebody needs a very simple day case procedure, even with the medical card, you could wait months on the public system, whereas if it's a routine day case procedure with private insurance, you can still go into the private hospital. So I hope that's of some help to you.
Your mum's in good health otherwise, Mary, is she?
Yes,
she is. Yeah,
yes,
good.
She is,
good.
Yeah.
The texter here wondering, Dermot, as well. 087 1400 106 is the WhatsApp. This listener says they've got Inspire cover by Leia, trying for a baby. Is it the best scheme to be on? And how does it work for maternity?
Yeah, Andrea, they have a very good plan. It's a very good corporate plan with Leia Healthcare, currently costing €1,308. All the other equivalent plans with the other insurance companies will be in around the same price. And that plan has really good refunds on outpatient expenses and also good maternity cover. So they're on the right plan is what I would say to them.
Where they are.
Two things. Yeah, do you know what? Just check with Leia, tell them exactly where they're going, what consultant they're attending and so forth. They will explain exactly what benefits they can claim, because lots of people don't claim benefits they're entitled to. And the second thing is, when the new baby arrives, make sure you phone the insurance company, put them on the policy immediately. No cover from date of birth till the next, no charge from date of birth till the next renewal.
Okay. Lindsay is on the line as well. Lindsay, what's your question? Have I got Lindsay there? Hi, Lindsay. How are you? Good.
Good, not too bad. So we were originally on BHI, the PMI 3613 policy, which is it's quite expensive. But my husband has changed jobs just starting this year, and he's going to be with Irish Life, but he doesn't have cover for the rest of the family. And one of our daughters, she has additional needs. So she would kind of need the cover for the likes of SLT, occupational therapy, that kind of side of things.
So who should you go with?
Yeah.
Dermot?
Okay. Yeah, Lindsay, very good question. So here's the thing. The 3613 with VHI is still a very good corporate plan, and the 50% refund that they give you, it's very good for the likes of speech language therapy, occupational therapy, because unlike other plans, there's pretty much no cap. Some other plans will say you get 5 visits or 7 visits. And by the way, if your husband is going to go with Irish Life Health, the rest of the family can still remain with VHI. I would suggest you contact VHI and tell them exactly what type of expenses you're going to cover, because they may have some other lower cost plans, such as the company plan plus level 1.3 or the PMI 0710. But I have to say, for the types of expenses you've mentioned, Lindsay, that 3613 may very well be the type of plan you need to be on.
Okay. Lindsay, thank you for getting in touch with your query. We've a voice note as well, Dermot, in from David.
Hi, Dermot. Thank you for all your assistance and advice. We are a family of 3, 2 adults and 1 child with VHI policies up for renewal. We are on adults on company plan plus level 1.3, and the child is on the 1 plan family. Just wondering if there's an alternative product out there with the same benefits at a more competitive price. Just looking to switch up at the moment. Thank you.
Any alternatives, Dermot?
Yeah, do you know what, Andrea, here's the thing. David is on a very good corporate plan for the adults. That company plan plus 1.3, super cover 1447. And I would the plan they have the child on is not a corporate plan, so they're not getting money back on the routine expenses. So I would suggest they actually consider putting the child on the same plan. Might cost about an extra 50 or 60 euro, but now they'll get 50% back on all their expenses. If they are under pressure to reduce their costs, they need to check out, for example, the Health Guide 2, with Irish Life Health, which is basically slightly cheaper, or the Inspire scheme, the Health Guide 1 with Irish Life Health, or the Inspire scheme with Leah. But to be fair, he has selected well. He's still got very good cover, and the savings will not be significant.
Just finally, Robert, I think you had a quick question too. Have I got Robert?
Hello, yes, this is Robert here.
What's your question, Robert?
Yeah, myself and my wife are both with Leah, and we're paying roughly $3,000 per year. I'm just wondering, we're on Connect Simplicity or Simplicity Connect. I'm not sure which way it is. I'm just wondering, is that the best plan for us?
Okay.
And my wife has problems with osteoporosis.
Dermot.
And she also has a medical card.
Okay, so Robert, what I would say to you is, look, your Connect Simplicity is still a very good plan, €1,530 each. The only thing on that plan, Robert, that you need to be careful of, the insurance company has reduced the benefit for hips, knees and shoulder replacements, where you now have a 20% shortfall. You didn't have that last year. If that's of concern, and you mentioned osteoporosis, there is another plan with Leah Healthcare. It's called Simply Connect, which is probably about, let's just say, €50 dearer each, but now you will keep your full cover for hip, knee and shoulder replacements. It's not an identical plan, but look, if you are concerned about that type of cover, I would speak with Leah straight away, check out the Simply Connect. If that's not a concern for you and you want to keep the benefits you have, that Connect Simplicity is still a very good private room corporate scheme. So once again, you selected well, but just be mindful of that change that they just introduced from your next renewal.
We could talk to you, Dermot, for an hour today with the number of people getting in touch, about the increase to their insurance premiums. We'll make sure to podcast this. We'll share it on X, on Twitter and on Instagram as well. But Demot Goode from Total Health Cover, I should say, part of the Locked-in group. Dermot, thanks a million, as always, for joining us here on Lunchtime Live. We'll chat at midday tomorrow.
Follow at Newstalk FM on Instagram for the latest videos from our presenters.